You just walked out of your orthopedic doctor's office and you were told that you could continue physical therapy, lose weight, try a steroid or gel injection, or consider surgery. You've likely been told that you've lost cartilage between the bones in your knee, which is causing your pain. Did you know that over 1 million gel injections are performed annually in the United States each year for knee pain related to osteoarthritis? Dr. Jacob Neiman here, board-certified pain medicine physician, and if you're dealing with knee pain, perhaps you've heard of these before. I made this video so that you would learn everything you need to know about these injections, including what the gel is made of, how they work, and whether they help alleviate knee pain for those who have wear and tear arthritis. Go ahead and like this video now, because by the end, you'll understand my honest opinion on whether or not you should look into this treatment. So what exactly are these injections? Well, they actually go by a few names. There's a big term called viscosupplementation, but you can also call them gel injections, which I prefer, much easier. They're also known as hyaluronic acid injections, because literally that's what they're made of, hyaluronic acid. This acid is naturally found in your joint fluid. It acts as a lubricant and a shock absorber. The idea of the injection is pretty straightforward. Inject a synthetic or animal-derived hyaluronic acid into your knee to replace the cartilage that you've lost. Common brand names include Synvisc, Euflexa, Orthovisc, Monovisc, and Gel 1. Some require one injection, while others require 3 to 5 injections over several weeks. The treatment has been around since the late 1990s, and millions of people have tried it. Now, this makes sense, right? Replace the missing lubricant, reduce friction, decrease pain, and improve function. Well, some studies do show some benefits, where patients report less pain and better mobility, but really the research is mixed. It's actually not at all really that convincing to me. Large systematic reviews and meta-analyses show that when you combine all the studies that have been done, the benefit is pretty small. Now, there could be a possible reduction in pain that, might be significant on paper in these studies, but does that always make a meaningful difference in your day-to-day life? I'm not so sure. The American Academy of Orthopaedic Surgeons actually does not recommend these injections in their clinical practice. But on the other hand, the American College of Rheumatology says, well, they might be appropriate in certain situations. Well, what are those situations exactly? Well, it seems like if the experts can't fully agree, that should tell you that the evidence on these treatments is a little mixed and not very convincing. So let me tell you a little bit about my own experience. I've taken care of many patients with osteoarthritis, and I have used this treatment when we've tried physical therapy, anti-inflammatories, we've done steroid injections with very little effect, and when the proper insurance carrier covers it, we've done it. I've seen patients get 6 months of benefit. I've seen patients get a few weeks of benefit. Some patients required 3 injections and others required 5. It kind of varied, and I've also seen where the injections didn't work at all. So despite this mixed evidence and my own anecdotal experience, some people do get real relief. You might be a better candidate if you have mild to moderate osteoarthritis, but these definitely do not work for those with severe bone-on-bone arthritis. Younger patients, typically under 60 years old, seem to respond better to these injections, or at least that's what some studies would suggest. Now, if you tried physical therapy, weight management, steroid injections, and other conservative treatments really without enough relief, and if you want to delay knee replacement surgery, maybe this will buy you some time. Though again, if you have severe osteoarthritis, forget about it. If you can't take anti-inflammatories due to stomach issues or other health problems, yeah, maybe you should consider it. The bottom line is that really the evidence is pretty weak, and recommendations from the medical system are mixed. And personally, I've seen some patients get better, and really some others, it did absolutely nothing. So, is this just a placebo treatment? Well, even if it is, placebo can be helpful, but you know what? That's an entirely different conversation. Let's get to the risks and the downsides of these gel injections. The most common side effects are pain, swelling, and warmth at the injection site. However, these are temporary. They usually resolve just within a couple days. But there is a small risk of infection anytime you inject anything into a joint. We're talking, less than 1%, but it's not zero. Some people have allergic reactions, especially to the products that were actually put into the gel substance. Cost is a huge factor as well, and that's a big downside. Each series can run from $500 to $1,500 or more, depending on insurance coverage. And many insurance companies, unfortunately, are increasingly restrictive about covering these. Why? Well, if you look at the evidence, It's mixed, it's confusing, it's not straightforward, they don't all agree. Anyway, look up your own insurance carrier's policy to see if you'd be a good candidate and see if they would cover it. You might need to repeat these injections every 6 months to maintain any benefit, and similar to steroid injections, they might lose their effect over time. But how do these compare to other treatments? Well, steroid injections actually work faster than gel injections, and the evidence is stronger for steroid injections for short-term pain relief. However, as I've talked about in another video, steroid injections can potentially damage cartilage over time with repeated use, so they're not a really safe long-term solution. Physical therapy does have solid evidence behind it for both knee and hip arthritis. There's no side effects of physical therapy beyond, temporary soreness, and hopefully you gain strength and function. Anti-inflammatories like ibuprofen work well for many people, but they have those gastrointestinal and some cardiovascular as well as kidney risks, so you do have to be careful about those things. Platelet-rich plasma, or PRP injections, are another option, which are actually likely superior to gel, but these are much more expensive and not covered by insurance. Now, the gel injections are safer, in my opinion, than daily NSAIDs and less invasive than surgery, but they are also more expensive and less proven than physical therapy. So these injections might make sense as part of a comprehensive approach, but definitely not as your only strategy. And again, I want to reiterate this over and over again because I can't say this enough. Knee replacement surgery has far better outcomes and evidence for severe cases. In the end, my honest opinion is that gel injections for knee osteoarthritis are overrated and oftentimes underperform. I've seen it. They sound like the perfect fix, but the results are pretty disappointing most of the time. The evidence is weak, they're expensive, and insurance rarely covers it. Personally, I'd start with more proven strategies for knee pain relief from osteoarthritis. Weight loss if appropriate, physical therapy, exercise, maybe just a short course of an anti-inflammatory for a couple weeks if you can tolerate it. Or if you have the money, platelet-rich plasma or PRP injections are something to look into. If you've done all that and you're still struggling and you're simply just not ready for surgery, then yeah, you can think about these injections as a reasonable option. Just go in with realistic expectations. You might get 3 to 6 months of modest pain relief, or you might get nothing. Don't let anyone tell you that this will cure your arthritis or permanently fix your knee or give you the cartilage that you also have lost. If you tried it and it works, fantastic. I'm happy for you. You've bought yourself some time and improved your quality of life. Now, on the other hand, if it doesn't work, you really haven't lost much money and time, just a few weeks. Talk to your doctor about your specific situation, your age, severity of your arthritis, other health conditions, and your insurance coverage. And please don't skip over physical therapy thinking an injection is just going to do all the work. Strengthening the muscles around your knee is crucial, regardless of what other treatments you try. If you found this content helpful, please like and subscribe. Drop a comment about your experience with knee injections, gel, or steroid. If you found this helpful, please like and subscribe. Drop a comment about your experience with these injections. And if you enjoyed the video, go ahead and click on the link to the next video, during which I discuss everything you need to know about steroid injections for your knee and hip. See you then.